yento aso emawa na ye wiase nyina da isi won mo edema aye anesthesia for bi aye body ni kase wu kwa ya sabia na abaye surgery na bibi o ma ya na ye bo pane se ye CS ye bo pane wo wachi na adwudwu fom nyina no madwuma no na enne na wiase nyina ye ka mo ho asem mpanyifo ekyese ne dey no omo de beka cancer kokoram enne ne bua ye den se omafo ebeje ho ayarehwe
Kokuram ene enyarewa afoforo bi e ka ho no enyarewa ahoduo bi a se ba wo bi so a ehu behia se obeye no operation radiation therapy ene chemotherapy na saa ayarehwe ahoduo nyina no anesthesis edi mu akotene pa se okopie mu e wo oncology department a e wo konfo anoche aban ayaresabi a wonum asan yarewa yi bi adokoro wonum ene wonum abusua e ya na wonum adwenum aye wonum kesenene se wotena se aye nhwehan ama yarewa yi akum wo mu ananso se wokwakwepo bosia ababepe ayarehwe
Omohwe kama but skano de omojawa this wakotie ben omoma pipa bia this wakoto adro timito adro 11 million 10 million 120 sa muna ye nyina yewo te se ndemi ba yese no ye den ya ombetwura adro na amame ombetwura amame a ebe 1000 ko
me bani we na eka mabudi ejinyame edi maye edi tise yare no nya yare ketwa ti ebese for boa
Dr. Sofa Ankra anesthesiologist specialist awa yare sabia honomo wachire mu se kokram yare eka ewo mu no edoso pa ne senti se wonomo asabi woni bie no yare bi ba won so a ontumi ntoa so enya yare hwe adwumason a anesthesia edie ewo bra wokoye wo bi operation anase ayarehwe foforo mu no sebe ya won fa ya obebre mu no mami echire mu.
The cost of cancer treatment is very expensive. I think their chemotherapy, radiotherapy, all that is very expensive. So if there could be some form of incorporating it into our health insurance to subsidize the prices, I think it will go a long way, because most of them come report early, but then because of the lack of funds to start treatment or to continue, some start but they are unable to continue, the disease progresses and then they end up with at the end stage where nothing else can be done for them. So I think the cost is the main thing that's the policy makers.